Marlene Brun from Tarlac State University, College of Nursing, BSN 2B. So for today, we'll be performing the perineal care to female and male patients. And then the delegation, this procedure may be delegated to unlicensed assistive personnel that have proper training, and the nurse retains the responsibility of this assessment. So for the procedures, we have the following equipment needed for this. We have the towel, gloves, the bath basin, and then soap, wash clothes, the protective pads or the linen, and then also the cotton balls or the gauze. And then the scientific rationale of this, the water is to be warm to allow the comfort. Hot may be damage the skin, and it may discomfort to the patients. And some facilities may have bath blanket and prepared cleansing tissues or the towels. And then after that is, don't forget to introduce yourself to your patient. So, hello ma'am, I'm your nurse Arlene for today po. May I know your name po? Can I see your tag, ma'am? Okay, Miss Hannah. So, kailan po yung birthday nyo, ma'am? Okay po, Ma'am Hannah. So, ilang taon na po kayo? Okay po, thank you po. And then, after that is to, don't forget to wash your hands. So, I'm done to wash my hand, and I'm already wearing my gloves. And then, after that, provide the client privacy, close the door and the curtains, and have the adequately lighting. And then after that is prepare the patient by folding the top bed linen to the foot of the bed. And then for the rationale of this is, assessment cannot be completed unless genital area is visible. Perineal or the genital area of the patient. So, tataas lang po natin, ma'am. And then, place a bath towel under the patient's hips. To prevent the bed from becoming soiled. So, ma'am. Okay lang po natin ito. Kabila po, ma'am. Okay po, ma'am. And then after that, position and drape the patient. The rationale of this, draping the patient minimizes exposures and provide additional warmth for the patient. Okay, and then after that, for the females, have the patient lie on their back with knees flexed and spread apart, allows the adequate visibility and access. The flexing knees decreases the stress on the lower back. And then drape the legs by covering the torso. So we will covering the torso, and then additional sheet blanket tucks on corner under the inner sides of the legs, and allow the sheets cover into the pubic area until cleaning commences. And then, a separate top sheet may be used to provide additional warmth and comfort to the patient, decreasing the upper thigh exposures and allowing a loose drape to cover the pubic area decreases the sense of exposure on the part of the patients. And then, clean the labia majora, then spread the labia to wash the folds between the labia majora and the labia minora. The rationale of this is secretions in this area tend to collect and facilitate the bacterial growth. And then clean in the directions upon from perineum to the rectum. And then wiping in this manner prevents cross-contaminations of areas. And then using separate quarters of the wash clothes for each stroke, while from the pubis to rectum. Using this clean portion of the clothes discourages transmission of the microorganism, and wiping from the area at least contamination to one or more contaminations prevent spreading of the microorganism. So for menstruating patients or those with indwelling catheters, disposal clothes, the gauze, or the cotton balls may be useful. Use a clean area for each stroke, and for the rationale of this is additional soiled areas may require the use of additional clean supplies that promote easy disposal of soiled surfaces. So, we have here the towel, and then fold it. So, here from the pubis to rectum, from side down, and then side down, and then middle down. And then after that is with a catheter, wipe in the direction away from entry site, and wiping away from the body portal prevents microorganism from entering into the body cavity. And then rinse well. May use peri-wash bottle container, and having the bedpan. So here the bedpan. So rinse well. So yan, para mag-flow yung draining fluid. And then after that is, the rationale of this is to soap residue may act as irritant and harbor microorganism, and allowing the free flow of the fluid is soothing of the patient, increases the effectiveness of removing residue from this area. And then dry thoroughly by paying attention to the folds between the labia. And then the rationale of this is moisture support and promotes the growth of any microorganism. So from here, the pubis to rectum, and then middle. And then after that is assess the area for the evidence of the redness, irritations, and drainage, especially between the labia females or the around dwelling the catheters, and then indicates skin breakdown. And then reposition the patient on the side facing away to the clean between the buttocks. May use tissue first to heavily soiled, and provide visual inspection of the area. Tissue is more readily disposable naman, and reserve the wash clothes for the final cleaning. So, bababa lang po natin, ma'am. Expose naman po natin yung buttocks po ninyo. Side po tayo. After positioning the patient, we will use this towel to clean the buttocks. So, from this side down, and then side down, and then from the middle, side and down. And then after that, use a dry towel. When you use this towel to dry the buttocks, you can use any circular motion. And then after that is position the patient into the comfort positions. And then you will remove this towel under the patient. So, ma'am. Dito po tayo, ma'am. And then position the patient into the comfortable positions. So, ma'am, are you comfortable with that position po? Okay po. So, we will move for the males. So, first, assist the patient into the supine position. And then, position knee, flex, and hips slightly rotated externally. So, assuming that we've done for that position, and then provides for access and prevents stress on the lower back of your patients. And then, wash and dry the perineal area, and then clean the inner thigh and general perineal area first. So, we will expose it, the genitals of the patients, and then we will wash the inner thigh or clean the thigh of the genital area of this male patient. So we will start to clean the thigh from clean to dirty, and then clean to dirty, and then after that is to for the rationale of this, cleaning from an area at least contamination to one or more contamination prevents spreading of this microorganism. And then for this, wash and dry the penis using firm stroke. Begin a circular motion, the glans, penis, and wash towards the base using separate quarters of the clothes. So that we will move this to clean circular. So from this to this, and then from the base here down, and then here down, another again. From here down, and then here down. And then the rationale of this is using the clean portion of the cloth, discard this transmission of the microorganism from one area to another, and wiping from one area at least contamination to one or more contamination prevent a spreading of this kind of microorganism. So for unicircum patients, retract the foreskin exposing the tip. Yan. And then after that is the rationale of this is smegma collects and under the foreskin which can be harbor bacteria should be removed. And then penis clean the glands and replace the foreskin, and replacing the foreskin prevent restriction of the penis which may cause the edema. And then after that, wash and dry the scrotum. The posterior folds of the scrotum may be cleaned more easily when the rectum is clean. So from here to here, and then from here to there. And then after that is the rationale of this, the scrotum may be more soiled than the penis since it is closer proximity to to the rectum, and therefore, the penis is usually clean first. And then, inspect the perineal orifice, and then, the intactness, especially the catheterizations of the patients. Okay? And then, indwelling catheters may cause excoriation around the urethra from the pressure and frictions. And then, after that is reposition the patient side away and clean between the buttocks. May use tissue first, heavily soiled, and pay particular to the posterior scrotal folds. Okay. Provide visual infections of the area tissue is more readily disposable and reserve the wash fluid for the final cleaning. So sir, likod po tayo. Okay, we will exposing the buttocks of the patients. So, and then, from this side, down, and then from this side, and then after that, dry it. Dry area well and moisture support the bacterial growth. So, any circular motion when you dry the buttocks of your patient. Okay. And then after that is to assess the redness for the excretion, tenderness, discharge, and the drainage. Indicates the skin breakdowns. And then document condition of the skin. All data must be entered in the patient's record. And then report any abnormal data to the appropriate personnel, and any abnormal findings must have a corresponding nursing action. So, sir, babalik na po tayo sa comfort position niyo po. Okay. Okay. So, sir, are you comfortable in that position po? Okay po, sir. Thank you po. And then, this is the end of the assessing the perineal care for the male genitals. And then also, don't forget to remove the gloves and sanitize your hand using this alcohol.